Well, good morning, everybody, and thank you so much for joining us today. I'm Josie Osborne, BC's Minister of Health, and I want to start by respectfully acknowledging that we're gathered here on the territories of the Lekwungen-speaking peoples, known today as the Songhees and Esquimalt First Nations. It's a fantastic privilege to be here alongside Mayor Doug Kobayashi and Dr. Cassandra Stiller-Moldovan. And I want to say thank you very much, Mayor, for having us here at this fantastic city-led health clinic. What you just heard was the ad that will play in podcasts and other streaming audio, and it's a bit of a teaser as to why we're here today. As many folks know, our neighbors to the south are facing a time of real uncertainty, and healthcare professionals in the US have a really good reason to be concerned. They are seeing cuts to healthcare and science, attacks on reproductive rights, and their federal government even withdrawing from the World Health Organization. But this is causing many of them to look north, and what they see is hope. They see British Columbia. They see a universal healthcare system that is rooted in evidence-based care and compassion. They see inclusive communities where diversity is a strength and everyone belongs. And we're turning this hope into action. In March, I first announced that we were going to embark on a targeted recruitment effort to attract healthcare providers from the US to join our healthcare system here in BC. And before any ads even went up, we've seen a big uptick in the number of inquiries. And in fact, in the last few months, nearly 1,600 healthcare providers have expressed an interest in making the move, including more than 700 doctors and 500 nurses. Just last month, we heard from Texas nurse Rachel Smith-Taylor, who is moving forward on getting her license to practice in British Columbia. And this clinic, where we're at today, is also in the process of hiring a doctor from the US, Dr. Muthana Yaqub, who will start providing care to patients right here in Colwood later this year. Dr. Yaqub moved from Canada to the US as a child, and after finishing high school there, he trained and became a doctor. Through his experience in the US, he has seen patients having to choose to delay care, even during cardiac emergencies, because they simply cannot afford it. He feels that preventative health measures have been limited and, more recently, undermined. The core values that he learned when he was still in Canada are the ones he held onto the most strongly, keeping a default position of understanding, curiosity, and patience. And that's why he wants to give back and come back home. So I'm really happy to share that Dr. Yaqub has signed a preliminary and conditional offer, and the City of Colwood is working closely with him to get him here to practice in British Columbia. We're building on success stories just like this. Today, I'm thrilled to announce that our public marketing campaign in the US has officially launched. We are targeting the states of Washington and Oregon and key cities in California. We're inviting doctors, nurses, nurse practitioners, and allied health providers to follow their hearts to British Columbia. We're directing them to bchealthcareers.ca, where they can get more information about rewarding and dynamic career opportunities across British Columbia. They'll see our message everywhere, from digital screens and billboards to print publications, videos, and display ads. So now we'll get to watch a video that will appear on streaming services and connected TV.
More news from Washington today. New data reveals why.
If you want to care for others in a place that cares about you, come to BC. It's a place with welcoming communities full of opportunity and a universal healthcare system that puts people first. To live where quality of care meets quality of life, follow your heart to British Columbia, Canada.
Different ads for other locations, and so next is a 6-second video that people will see on YouTube and social media.
To practice evidence-based care and put people first, follow your heart to British Columbia, Canada.
We also have static formats that people will see in print publications, wall posters, and on billboards, for example. And on the screen behind me, you can see 3 examples of those. In total, there will be over 14,000 locations for out-of-home placements like billboards and digital screens located within a 10-mile radius of healthcare facilities. And this is in addition to digital screens such as wall posters, digital kiosks, ride-share screens, and digital screens in restaurants and grocery stores. We're expecting to reach about 250,000, that's 250,000 healthcare workers, which represents about 80% of our target audience that we know lives in these target areas. This will help supercharge our overall recruitment campaign to attract U.S. healthcare workers to BC. Together with health authorities, regulatory colleges, Health Match BC, and other partners, including local governments and communities, we've created a real Team BC approach. We're holding dedicated webinars and providing one-on-one support through everything they need to know, from credentialing to immigration to finding a job and building a life here in British Columbia. Once U.S. health professionals arrive in our province and they're ready to practice, they'll get to work in a variety of settings, from hospitals to long-term care homes to primary care clinics throughout the province. And an example is this clinic right where we are here in Colwood. As well, we have the Colwood Family Practice Medical Clinic not far from here that opened in 2023, where 4 physicians are from the United Kingdom. BC is growing, we're growing fast, and our commitment to strengthening public health care is for everyone, and that commitment is growing too. And we need more healthcare providers to ensure that people can get better care faster. So to our American neighbors, we invite you to join us. We invite you and your families to live in a welcoming, inclusive community here in BC, to practice in a healthcare system that puts people first, where your contributions create value and meaning in people's lives. And to Canadian health professionals who are currently living in the US, please come home. Together, we can build a future that is healthier, stronger, and more compassionate. So thank you to everybody, and most importantly, welcome to all of these future healthcare professionals. Welcome to BC. So I'm really pleased now to hand it over to the Mayor of Colwood to say a few words. Mayor Kobayashi.
Thank you very much, Minister Osborne. We're so pleased to have you here with us today on this exciting announcement regarding the recruitment of and the marketing campaign which is officially launched in the U.S. I think this is an outstanding initiative. So proud of our ministry for this. We at the City of Colwood are ready to go to bat for all family doctors that want to move to British Columbia, to Colwood. We're committed to supporting the health and prosperity of residents and providing access to healthcare services and family physicians in alignment with our strategic priorities. From a personal perspective, I'd like to tell you why it's important. They've given me 5 minutes to talk here, so I thought I'd do a fill-in. I can tell you I'm standing here before you today because I have a family doctor. I haven't had a family doctor in 20 years, and I had to have heart failure first before I actually got one. And the unfortunate party says, you know, everything that you've done, it was preventable if you had a family doctor. So I cost the system a lot of money. I'm afraid to tell you that right now, but that's the truth. I didn't have a family doctor. And the bad news after I went through my heart condition, he says, oh, by the way, we weren't going to tell you this until after. You're diabetic. Again, the reason why you have to have a family doctor. And recently, I can share this with you because my wife gave me permission to share this with you. She was lucky. She just picked up a family doctor 2 years ago. And she developed breast cancer. And it wasn't something that she could pick up. You know, there's ways that you test yourself, and she didn't. If it wasn't for our family doctor, she would have probably been marching along for the next 10 years, not realizing that she had breast cancer. It was observed right away, treated right away, and now she's in recovery. Phenomenal, all within a couple months here. So I could tell you that from the heart, why family physicians are so important and so important to me. So we as a city fully understand the amount of work and dedications that doctors have undertaken to get where they are. Without doctors in British Columbia or in our community, we're just not whole. The launching of the Ministry of Health's advertising campaign to attract more healthcare workers from the U.S. will strengthen our public healthcare system and benefit all residents in British Columbia. The City of Colwood looks forward to continued collaboration with your ministry, Minister, in healthcare delivery. Thank you very much.
Thank you so much, Mayor, for your words. It's now my pleasure to introduce you to Dr. Cassandra. I'll just call you Dr. Cassandra, who is also going to share a few words.
So my name's Cassandra Stiller-Maldovan, and I'm a family doctor and a sport and exercise medicine physician as well. I recently moved just in January from London, Ontario, to come take part in this Colwood Clinic initiative. I am so passionate about primary care and really do feel it's the foundation of good health care in Canada. And we're lucky enough in Canada to have access to universal health care. I think this push to bring physicians from the US to Canada and to recruit Canadians that are in the States is phenomenal. Canada is an amazing place to practice medicine. You don't have to fight with insurance companies to get pre-authorization. You know that your choices that are evidence-based, and when you order tests, they will be covered and your patients will get them without having to go bankrupt to get good health care. This project here in Colwood has been incredible for me. I really do feel that it is one way that we can continue to support primary care in Canada. This initiative allows doctors to really focus on what they do best, and that's providing primary care to our patients in our community and allowing the business component of running a medical clinic be left in the hands of the clinic, the people who already have expertise in running a business, and allow us to focus on good health care. It's been a pleasure being part of this project so far, and I'm really excited to accept new physicians that are coming on and to continue to recruit more physicians. Like Minister Osborne said, BC is growing, and to help meet the needs of our BC residents, we need more doctors. Come join us. BC is incredible. I'm so happy to be here, both for myself and my family, and we're excited to invite and share this beautiful place with all of you.
Fantastic. Thank you so much to the Mayor. Thank you, Dr. Cassandra, for your words. We are absolutely thrilled with what's taking place here and just delighted to be able to show everybody a sample of the videos and the ads that we know that people are just starting to see now in the U.S. So with that, we will end our remarks and very happy to answer questions.
Thank you. A reminder to reporters on the line, please press *1 to enter the queue. Media in the room with questions, please join me over here. I will start with you. This is Katie DeRosa, CBC.
Hi, Katie.
Hi. Minister, obviously the number of doctors you recruit is limited by immigration. We know that the provincial nominee program, for example, has been lowered this year. So how many positions do you expect of the, I think it's 1,100 that BC can take total from the provincial nominee? How many do you hope are going to be physicians? And can you, like, the licensing is one aspect, but is the immigration side another stall? And is the federal government doing anything to sort of address that aspect?
Thanks for the question. So this is an important point that British Columbia is doing everything that we can to make it faster for American-based healthcare workers to come to Canada, to come specifically to BC, and that includes changing the credentialing system to make it faster and easier for American doctors and nurses to come. The College of Physicians and Surgeons has just passed bylaw changes that will be implemented soon so that American-trained physicians will be able to bypass some of the exams, for example, that they used to have to take. But immigration is a federally regulated process, of course, and it has been a challenge that the provincial nominee program, the only way that British Columbia has any control over who is able to come in and work in our province, has had a decrease in its capacity. So it was from 11,000 to 10,000 to or 8,000 and now to 4,000. So we'll do everything we can to ensure that we maximize that for physicians and nurses. We'll see who is coming in. We want to make the best matches possible with where we're experiencing some of the biggest gaps. But we'll also continue to press the federal government for changes here. This is not just an issue in British Columbia, of course, this is an issue across Canada. And I think that it's incumbent on the federal government to work closely with provinces to do everything we can to recruit more healthcare workers to Canada so that we can strengthen our system here. I have already spoken to the new federal health minister about the importance of this, and I look forward to being able to speak with her further as well as with the new immigration minister.
And this one might be for Dr. Cassandra, but in terms of Dr. Yacoub, is someone able to give a timeline of when he started the process? Like, would that have been before you guys fast track? Because if they're coming later this year, how long total was that whole process for? I know the clinic only opened earlier this year, but is there a timeline for when Dr. Yacoub kind of started and when they're expected to arrive and which part of the U.S. they're living in?
Okay. Mayor, you want to step up here? Yeah, for sure. Thanks, Mayor.
Dr. Yacoub applied just over a month ago. Is that right, Jen? Just over a month ago. So he has to still go through all the rigmarole, including the English proficiency exam.
And so when do you expect them?
1 November. Okay, thanks.
Oh, hi, Minister. Mary Griffin from Czech News. I just have a question about the BC Family Residence Program. I just want to know what the reason for the cuts to the program is, and wasn't it originally created because of the lack of an equity for families living outside of Vancouver, the Lower Mainland, because all the specialized pediatrics services are located there. So families who are from the island and from the rest of BC face a financial burden when they have to travel there for help for their kids.
Thank you. So you're referring to the BC Family Residence Program, which is a program that government actually stood up in 2010 to help with the travel and accommodation costs, particularly for family members for children who need that life-saving care. And it's an incredibly important program, and I really empathize with those families who have 6 children, for example, and they need that support. It's already a high emotional toll, but it's a financial burden as well in order to come down. And that's why having a program like this where we're able to support families to bring people to places like BC Children's or down to BC Women's Hospital, for example, is so important. This, in the fiscal environment we're in right now, the health ministry, like all ministries, has been given a mandate to review programs, and so we were not able to expand the funding that we provide, and that has put some of the providers in a challenging position, and I recognize that, to make changes to their programs so that they can serve as many families as possible while we all continue to manage the costs that are there. We're going to do everything we can through the Provincial Health Services Authority, for example, and through the healthcare facilities to support families to the best extent possible. And I know that the PHSA and BC Children's and Women's are continuing to explore other funding opportunities.
Okay, but as of June 1st, the cuts were made. Families haven't been informed. And I'm just wondering, one of the cuts that have been made is there is now an income threshold of $85,000 for a family. But families with children who are critically ill have said that this is the most stressful time of their lives. And of course, usually one of the income suffers during often months of treatment for their children. So to my knowledge, nothing has been directed towards those families who are in those situations. None of the financial assistance. I mean, even the Ministry of Health, your own website shows that the program is still in full effect, that the cuts haven't taken effect yet.
Well, thank you for that, Mary, and I'll certainly do everything that I have to make sure that the website and the information is absolutely accurate and up to date. And it is you're absolutely right, it's an incredibly challenging time for families when they have to undertake this kind of travel. And that's why I know that some very challenging situations for providers in this case who are doing their very best, and they do such a fantastic and wonderful service providing that assistance to families. And we're going to continue to do everything we can to support families, and at a time when we're also doing cost management measures and extending every dollar as far as it possibly can go. I really appreciate the question. Thank you.
Next question comes from Wolfgang Deppner, Canadian Press.
Yeah, hi, good afternoon. Thank you for taking my question. Minister, I'm going to switch topics a little bit here, and I was hoping that you could comment on the situation at KGH. So KGH is one of 2 tertiary hospitals in Interior Health, serves a region of just under a million, about 900,000 people. It has seen a number of issues around the pediatric ward. We've also heard from maternity ward doctors who are concerned about an imminent collapse in the provision of maternity services at that hospital. What, if any, message do you have to residents in Interior Health who are concerned about the state of one of their central hospitals? Doctors have talked about ripple effects sort of coming from the closure of the pediatric ward. Can you comment on the situation on KGH? Thank you.
Yeah, thanks for the question, Wolf, about Kelowna General Hospital. So I think, as most people know, the pediatric unit has been temporarily closed for a 6-week period by Interior Health as a result of a shortage of pediatricians in the hospital. I want to assure all families in Kelowna that they should continue to take their children to Kelowna General Hospital, that all children that need to be urgently seen are being seen, and that has not changed. They will continue to get the best care possible at Kelowna General. During this time, while the pediatric unit is stood down, this enables the pediatricians who do work at KGH to be able to stay focused on those urgent cases and to do the work that they have to do while Kelowna General Hospital and Interior Health continue to attract and recruit new pediatricians. And I'm happy to say that there are several pediatricians who are coming online so that will help to stabilize the unit. That's had sort of trickle-on effects and also a complementary issue around the change in family doctors able to deliver babies locally in Kelowna. And the obstetricians and gynecologists, the specialists, are seeing an increased burden. And in this case, in both cases with the pediatric issue, obstetricians and gynecologists, I know that Interior Health is meeting with the doctors, is talking to them about the recruitment issues. And again, I just want to place this in the context of the global healthcare worker shortage that we are seeing. And that's exactly why we're here today, talking about how we are attracting new physicians to come from the U.S. to practice here in British Columbia, because we know that shortages like these are seeing impacts in communities just like Kelowna. And of course, our hope and our desire is that we're going to be able to attract and retain new doctors and nurses to build out these gaps and build our healthcare system, because we know British Columbians depend on these healthcare services being there for them when they need them. And when you're about to deliver a baby or you have a sick child, taking them to the hospital, that's exactly the kind of service you need to get.
Do you have a follow-up, Wolf?
Yes, I do. Thank you. You mentioned a figure of 1,600 healthcare providers who've expressed interest in coming to British Columbia. But can you point to any specific numbers? Can you say at this stage how many have actually committed to coming to British Columbia? How many doctors are we talking about? How many nurses are we talking about? And what, if any, steps is your government taking to compensate the fact that physicians in the United States can earn significantly more in the United States than here? Thank you.
So first of all, to numbers, before an ad even went up, we've had over 1,100, nearly 1,600 healthcare workers who have expressed interest, who have inquired. And that's over 700 doctors and over 500 nurses. We've never undertaken a recruitment campaign like this before, so we are building out the system that will enable us to track the inquiries as they move through the system. So who takes a webinar through BC Health Careers, working with Health Match BC, who accepts an offer, people moving into communities, and we'll be able to report out on those data in time. And we're going to do everything we can to attract as many physicians and nurses as possible, of course.
Next question comes from Kylie Stanton, Global News.
Thank you, Minister. This is a question for my colleague Richard Sussman. Is the province relying too heavily on experts like Penny Ballum and Dr. Daniel Vigo to do work at a significant cost to taxpayers?
Thanks for the question. So Dr. Ballum, currently as the interim CEO of PHSA, is being compensated through a salary that way. Dr. Vigo is an employee of UBC and has been seconded to the province, and the province is reimbursing his salary there. And in addition, has set a contract up so that we have the benefit of having at least 5 more individuals working with Dr. Vigo to be able to provide advice to government. I think in both cases, this is understanding that we are in a period of enormous change, particularly when it comes to the toxic drug crisis. that the nature of this crisis is changing almost month to month in terms of the composition of illicit street drugs, the developing science, literally, of addictions medicine and psychiatry, and the need to determine the best care solutions possible for people who are experiencing some of the toughest situations, concurrent disorders of severe mental illness, of addictions issues, acquired brain injury from repeated overdoses. And that having an expert like Dr. Vigo come and provide advice to government and undertake a very methodical and studious examination of the data that is out there, looking with legal experts at the Mental Health Act to provide the kind of interpretation and guidance to physicians across and clinicians across British Columbia. This is not something that can be replicated inside government. It is really important at this time that we have this expert advice, and the recommendations that Dr. Vigo and his team have put forward to government are actions that we are already seeing underway, opening 10 of the involuntary care beds at Surrey Pre-Trial Centre, 18 new beds at Alouette Homes in Maple Ridge, looking further afield into other health authorities to find sites for involuntary care, and incredibly importantly, providing the level of care that fills a gap that exists in our system. Dr. Ballum continues to provide very high-level guidance and advice because, of course, she's very busy with the work that she's doing at the PHSA. And not for a minute do I doubt that both of these individuals are worth every penny in terms of what they're providing to government in terms of advice and helping us move forward with real solutions that are making an impact for people.
And just as a follow-up, I know this Colwood clinic is a pilot, but we've done several stories and a lot of other jurisdictions are looking at it and, potentially looking at expanding it into their communities. Is that something that the province is looking at as well, given that they have some doctors now coming on board and other ones set to start November 1st, that sort of thing?
It's a great question because the mayor and I were just talking about this. So we just met before today's announcement to talk a little bit more about the steps that Colwood went through to establish a clinic like this. And I really have to give kudos to the municipality, to the mayor, council, and his staff for their leadership in developing a model and working with the ministry in order to set up all of the behind the scenes actions that had to take place in order to see this come to fruition. I think there are many other municipalities, as the mayor has told me. He gets a lot of different inquiries. I'll ask him to speak in a moment. But this is something that we're very keen to continue to work with other local governments on. I've had a number of inquiries from local governments directly to myself and to the ministry, and we'll do everything we can to support this. To me, this is about partnership. This is about recognizing that all levels of government have a role in strengthening our public healthcare system. And I really do give kudos to the municipality here for stepping up in the way that they have. Mayor, do you want to add a few words to that? He's good? Okay, all right. Mayor's good.
Next question comes from Andrew Garland, CTV.
Thanks, Minister Osborne. Will the doctors be getting some sort of signing bonus, and if so, what would that look like?
So in terms of the physicians that could come or will come from the U.S., so they'll make their inquiry through BC Health Careers, and we'll match them with a person who will help guide them to find the right match for them in terms of job opportunities and working with local governments, communities, divisions of family practice, all of the local and regional healthcare partners to find the best match for those physicians. And the salary negotiations will be dependent on who they're applying to.
What is the cost of this marketing campaign in the U.S.?
So this campaign is a $5 million campaign that has been funded inside the envelope that government already has. And again, as you've seen, we'll see over 16,000 different public locations where all kinds of digital displays will be available, really targeting healthcare workers too close to facilities where they might work. So you can imagine a person is commuting into work, driving into work, and they go past a big billboard and they see an ad for British Columbia, or they're on Netflix and they're watching their favorite show and there's an ad that pops up and it's advertising British Columbia. And we know these are the kinds of steps that we have to take right now to attract physicians to come to the province, and we are removing the barriers that they would have faced with their licensing and credentialing programs. We're going to do everything we can to get these doctors, nurses, and other health professionals working here.
I just have one more question about just a reaction on a different story. Are you aware of an incident in Vancouver last night where a man was arrested under the Mental Health Act after he drove a car into the Pacific Coliseum while an event was happening inside? Just wondering what your thoughts are on that.
Yes, I certainly am aware of this, and it sounds, I mean, just such a frightening thing to see or to witness or to experience. I am very grateful for the quick response of emergency responders in the Vancouver Police Department. I understand that this person has been taken to hospital and under the Mental Health Act and is undergoing assessment, and that I'm just so grateful that nobody was injured, and I'm sure there'll be more to say on this incident soon.
Okay, and now we're going to go to the phones, and our first question from the phones is from Mark Page, Black Press Media.
Hi, Minister. Thanks for taking my question. I apologize if this is something you covered. The call and drop for a minute there. Can you quantify what success would be here? You know, how many doctors exactly do you want to attract with this program, and how many nurses from the United States?
I have a really short answer to that, and that is as many as possible. We are undertaking this initial campaign for the next 6 weeks, and again, we'll see advertisements all over in Washington, in Oregon, in select cities in California. We're going to target about 250,000 healthcare workers living in the U.S. right now. Before we even had an ad out, we've had over 1,600 inquiries, and we'll be tracking those inquiries as they come in and talking in the future about how many physicians, nurses, and other allied healthcare workers were able to land here in British Columbia.
Do you have a follow-up, Mark?
Yeah. So, obviously we all know doctors and other healthcare workers make a lot of money in the United States. Wolf touched on this a little bit. Why not spend this money on this advertising in other jurisdictions where doctors maybe make less money, but they have similar education levels as they do in BC? And is this something that you've thought about, or you're working on, or what are some of the reasons behind, targeting U.S. rather than other places?
Yeah, well, first of all, just talking about compensation, we know there's a real variety of compensation models and remuneration across the U.S., and it's difficult to make very straight comparisons sometimes. But I can say that with some of the recent changes we've made and how we pay family doctors, we know that we have competitive salaries. We also know that we offer very competitive salaries for nursing. We offer some of the highest nursing wages in Canada, for example. We also know, though, that doctors are not just motivated by dollars and cents. And that's why one of the reasons why we're taking advantage of the uncertainty and chaos that exists south of the border right now, because we know that British Columbia is built on a healthcare system that meets the values of why people go into medicine and nursing and into healthcare in the first place. So knowing that we have a publicly funded universal access healthcare system, a single payer, reduces some of the administrative burden that Dr. Stiller Moldovan talked about, is a real attraction for US-based professionals. But we also know the training and certification that people receive in the States is very comparable to Canada, which makes it easier for us to really streamline the credentialing process. We are also looking at other international jurisdictions. We know there are countries like the United Kingdom, Australia, New Zealand, South Africa, for example, and doing everything we can to accelerate those efforts there. So there's more work to be done, that's for certain, but making sure that people have the credentials, the education, the experience that's needed to meet the public interest test here in British Columbia, of course, is incredibly important. It was described to me earlier today that if you look at healthcare recruitment like a target, we've got the U.S. right in the center in the bullseye, and then right outside in the next rings are countries like the United Kingdom, and that's where we'll be focusing our efforts next.
Next question comes from Emily Joveski, Vista Radio.
Hi, Minister. Thanks for taking my question. I'm just wondering how you'll be gauging the return on investment for this campaign, and will the province be releasing some kind of report down the road on that?
Thanks for the question. We'll certainly be reporting out on the success of the campaign with respect to the number of inquiries that we receive, the number of job offers or that are uptaken, and doctors, nurses, and other professionals who are moving here. Ultimately, the success is measured by what people experience in their communities. So Here in Colwood, for example, knowing that new doctors are moving here, Dr. Yacoub is coming from the States, he's going to attach a panel of patients. That's going to make a real difference in those people's lives because they're going to have that direct access into the primary care system. Primary care is the backbone of our healthcare system here in British Columbia. It literally is the doorway into specialty and into having a relationship with a healthcare professional who understands you, who knows you, and who is able to work with the challenges that you may face and help keep you well. So we'll measure the success by the way we're able to strengthen that system, fill existing job vacancies, and ensure that situations that are happening in communities right now where they're experiencing temporary closures, for example, of the pediatric unit in Kelowna General, and knowing that that's something that we've got to move past, and we've got to do that by continuing to train, attract, and retain more healthcare professionals here in BC, alleviating the burden in the primary care system by things like expanding the scope of practice for pharmacists so that people don't have to go to see their doctor or go to an emergency room in order to refill a prescription, for example, and continue with moves forward like the new medical school coming at SFU that will open its doors in September 2026.
Do you have a follow-up, Emily?
Yeah, does any part of these efforts and the marketing campaign target professions or specialties that are in the greatest shortage, like pediatrics, for example?
Well, that's one of the beauties about this is that it is a campaign that attracts interest from a wide variety of healthcare professionals. But when they go to bchealthcareers.ca, they will be matched with a person who will work with them in their specialty or area of interest with what careers and job openings are possible and available here in British Columbia. Of course, we have a big interest in filling the gaps that are the most needed, and family physicians is one that I've just spoken of, but we know, for example, pediatricians and in cancer care. And so we'll do everything we can to fill those gaps first. But of course, we welcome physicians and nurses and allied healthcare workers of all kinds and interests to move here in British Columbia. And we're also going to continue the work with local governments, the health authorities and other organizations to make the best match possible so people find a community that is open and welcoming to them and that they're able to move here to British Columbia and enjoy everything that we have to offer.
Next question comes from Nick Johansson, Castanet News.
Hello. I just wanted to touch on the KGH issues, the staffing issues we're seeing up here in Kelowna. Earlier this week, Interior Health CEO Susan Brown told us that a report had been submitted to the ministry this week about the immediate resource needs at the hospital. Are you able to tell us what that report contained and what the province will be doing in the short term to address these issues?
Thank you for the question. Yes, I've had an opportunity to meet directly with Susan and staff from Interior Health myself, and I know that that's being submitted. I haven't seen it myself, and I can't give you any specifics on it. But what I can say is just how important it is. The Ministry of Health continues to work with Interior Health, and equally, if not more importantly, that Interior Health is working with the physicians at Kelowna General Hospital to listen to their concerns, to understand their concerns, and to do everything they can to support physicians and ensure that the programs and services are in place during this time, which is very, very challenging for physicians and healthcare workers at Kelowna General, not to mention, of course, the people of families in Kelowna. And that's why we have to continue again, coming back to being here today and the work that we're taking to attract more physicians and nurses here in British Columbia, do everything we can to train more people, hire more people, fill the gaps where they are needed, and to really build out that system.
You have a follow-up?
No, that's fine. Thank you.
Okay, thank you, everyone. That's all we have time for today. Thank you for joining us.
Thanks so much, everybody.